Good evening, everyone. I want to thank you for taking the time to join us this evening. My name is Paul Kiss. I am on staff here at New Life Church, and it is my pleasure and my privilege to be part of this evening. It is an idea that took shape quite a number of weeks ago, and we did a little bit of thinking and planning and had a few conversations with Dr. Quigg and with Brian. And both of them agreed to be part of this evening, and we were just so excited when they both said yes. And I'm looking forward to a great evening. So I want to start off just by saying thank you. This is hopefully going to be a good investment of your time, and it will hopefully also be something that's going to give you some good information and help you down the road as you navigate, like all of us are, the next steps in dealing with the virus, the pandemic, and how we beat this thing and move through it. So I would like to give you a few guidelines for this evening and instructions. This is not obviously like a live Zoom call, but it is live. So we are all currently sitting here in front of our computers, and it's a question and answer night. So the main focus of tonight is for you to have the opportunity to ask the questions that you want to ask. So what we would ask you to do is, if you have a question, you'll see on the screen, at the bottom of the screen, there's a phone number, 705-999-8693. You can text your question to that number, or you can send an email to questions@newlifecollingwood.com. And we like long email addresses just to make sure you're awake before you send in your question. And when you have a question that you'd like to ask, please add your first name to it. Now, sometimes what happens in these is we might get a long email or a long text with a statement, and what we're asking for is for you to send your questions. We want to spend this evening getting through as many questions as we can, because there are lots of questions that people have. So our goal for the night is to try to make this about an hour or so. If it's going, if it's a really engaging conversation and the questions are flowing, we'll keep going for a bit. But we do want to be mindful of your time and the investment that you're making, and make sure that we end in a reasonable amount of time. So some people have said, why are you doing this tonight? Well, there's a couple of reasons. And the first is, we think that ignorance breeds fear. So by having an event like tonight, we're eliminating some of the ignorance, some of the lack of knowledge that we all have. And if we can give good information, we feel like that will help eliminate some of the fear that people might have around the pandemic. And so we're hoping that tonight will be a good opportunity to just give you some really good information, not only through what is said, but through some links that are going to be shared there in the video description underneath where you're watching, and you can access those at any time. The second reason why we felt tonight was important was for us as a church, as people who would call ourselves Jesus followers. We think that following Jesus means you seek the welfare of the entire community. And so tonight, our whole goal is to actually serve you and to seek your welfare by trying to bring some local experts and have them share their knowledge and their expertise with us. So with that, I'd like to introduce both of these gentlemen who are here tonight, Dr. Mark Quigg, who is from CGMH, and Brian Garback. So Mark has got his training at the University of Toronto and began his family medicine practice in 1989, has spent nearly a decade in Northwestern Ontario working among First Nations people. And then, Mark, you moved to this beautiful part of the province in 1997. You've been here ever since, and right now you are the head physician or the lead physician for the infection control team at CGMH. So welcome, and thank you for being here with us tonight.
Well, thanks for inviting me, Paul. And basically, all of us at the hospital and involved locally in healthcare are very interested in terms of educating the community about COVID, and are very appreciative of the opportunity to come and talk about it.
Your whole life, growing up in Wasaga Beach and now living in the Collingwood area. You're actually a graduate of CCI, so there's a shout out for all the CCI grads who are still in the area. And of course, that was a while ago in 1983. You
Wow.
graduated in 1987, and then just a few years later, you opened up the pharmacy in behind the hospital there in Erie Street, and you've been there ever since. And so we are glad that you are here bringing your expertise, and glad to have you on board with us tonight.
Thank you, and happy to be here, and not really sure I'll answer all the questions, but we'll do our best.
Yes, well, you'll have a few people probably following up with you afterwards, wanting to have some more information and chat. So that's one of the great things about both of you being local, is that you've got a vested interest in our communities in the Georgian Triangle, and that's what we really appreciate about tonight. Is this is all happening from people who are living with us and among us. So I don't want to really waste any more time per se, and so would love to get into just starting off with some Q&A. There are already some questions coming in, and I think the first question I wanted to ask you, and you can both jump in anytime you want, and share what you know or what you want to say. But the first question a lot of people are asking is, when is the vaccine coming? We keep hearing about the vaccine, and it's coming and it's coming. So can you tell us at all, like, when we might expect to have the vaccine rolling in our region here?
Well, Paul, I can maybe comment a bit on that. We got some good news in the last few days, because it wasn't that long ago we weren't expecting in a lot more vaccine deliveries to start ramping up till April, but sounds like we're going to get some vaccine hopefully into early March. And what that's going to allow us to do is, up to now with our limited supplies of vaccines, we've been focusing, well, the Simcoe County Health Unit, who basically the district health unit's in charge of the vaccine supply, they've been focusing on long-term care and patient-facing hospital staff. What more vaccine supply is going to allow us to do is to get people like first responders and the healthcare side, but hopefully also expand vaccination out to the above 80-year-olds. The most likely vaccine will be the Pfizer. That's what we've been told. And locally, our plan, as soon as we get some vaccine from our local family health team run by Dr. O'Halloran, is going to be a drive-through like we did for the flu shots. I'll defer to Brian in terms of, I know pharmacists are going to be involved at some stage, depending on the vaccine and depending on the rollout. So yeah, Brian, maybe you could comment on the pharmacy side of things.
Yeah, well, I believe we'll be involved. The problem right now is, well, the storage for the vaccine. So no pharmacy is set up to keep anything at minus, is it 78 degrees? So we're hoping down the road, well, they've actually added pharmacy technicians to join in the injection course. So that's telling me the government for sure is going to have pharmacies involved, but it might not be till we get something a little more stable.
Logistics of the Pfizer vaccine in particular are tricky. I mean, you know, it's in the fridge at minus 70, the same temperature as Antarctica. So, so getting it out to places is logistically doable, but complicated. Again, we've been told that that's going to be the vaccine for our area. So as a result, initially it'll be a central location. Again, the plan for Collingwood and Wasaga at this point, and we're waiting for confirmation of vaccine arrival dates and final word from the health unit and the provincial government, is that it'll be a drive-through. Eventually what happens is, when other vaccines, for example, the AstraZeneca, which is fridge stable, hasn't been approved by Health Canada, but hopefully will be approved like literally any day. That's when pharmacists like Brian will be able to administer it. Family doctors will be able to administer that in their offices. And we're all anxiously looking forward to that, because we want to join the fight and get as many needles in as many arms as possible to start cutting down on the risk of COVID and give people their lives back.
Well, some questions that have come in, and sometimes they come in batches and are somewhat similar. So there are people that are concerned that the vaccine is not really a vaccine at all, and are wondering what the definition of a vaccine, and what would you say to people who don't believe that that definition has been met? So that's kind of the first question, is just there's some that are worried like this really isn't a vaccine, and they're just wondering, how do you respond to that?
Well, I'll maybe start with that one. It's a new, well, the Pfizer and the Moderna are a new type of vaccine. As I say, there's several vaccines in the pipeline. The government has actually bought, I don't know, somewhere on the order of six from 6 different suppliers, all different types of vaccines. Some of them the more traditionally prepared ones, or along the lines of more traditional prepared ones that people have had in the past, and then the newer ones, which are Pfizer and Moderna, which are they called the mRNA vaccines. They're a new vaccine process. I mean, they are a vaccine. I think where the concerns were most people express is you'll hear people say that the vaccines have been rushed, that these things were developed too fast, and there's concern around that. And I guess what I'd like to kind of get across to people is that it's important to understand that when you develop vaccines, normally the process takes years, and it takes years for several reasons. The biggest one being if you're doing a meningitis vaccine, for example, you have to have one arm has people that get the actual vaccine, and then one arm has people that basically get a shot of saline. And then what happens is you have to go forward with those people for 2, 3, 4 years till you have enough cases of meningitis in one arm versus the other to be able to say the vaccine works. So often it takes years to develop that process, because COVID moved so quickly and it was trialed in places where there were such high rates of COVID. What normally would take 2, 3 years to get enough patients who were affected by the disease took about 2, 3 months. So they were able to process them much faster because the disease moved much faster, infected a lot more people. So that part of the trial that normally takes years literally only took 3 months. The other issue is, completely honestly, when I work with the First Nations, I work with Health Canada, and the regulatory bodies, they take their time. We'll have a meeting next month, and okay, we'll reassess in a month or two, and et cetera. And that all got compressed. All that paperwork stuff got compressed, saying that, look, this is a national emergency. We want you guys to get the paperwork done and, do whatever needs to be done to turn around and make a call whether the vaccine is safe or not. And so basically, the actual vaccine part or the science part was not compromised in any way, but on both the nature of the process, the vaccination trial could be done much faster because the disease was moving so much faster and affected so many people. And on the paperwork end, the government just basically tightened up the timelines. And so it's been through the same vaccine process that every other vaccine we've had in the past has been. As I say, it's just the non-critical parts were shortened.
Okay. I don't know, Brian, if you want to take this one. There's another.
I think you covered that pretty good.
Well, I'm going to roll into the next question that's related to it. Is a concern that the vaccines are dangerous and that they have some serious side effects or even can cause death. And what do you say to someone who comes into the pharmacy and wants to talk with you about that concern?
Well, so far we have the two newer ones, the Moderna and the Pfizer one. And the nice thing about it is you're not getting a live virus. You're basically getting something that's going to create your own immune system to create proteins that can then fight the virus. So technically, if no virus enters you, the proteins aren't doing you any harm. They're basically ready to just bump up your defense to fight the virus, quicker. And right now, we're cleaning everything with 99% alcohol. We're wearing masks. Our immune system is probably at its weakest point that it's been, I don't know, in decades. Where a common cold or a flu right now would probably put us in bed for a week. So I have this protein ready to fight the virus. That's basically what we're getting from from the vaccine.
I just want to make a comment a bit as well. First of all, take the Pfizer vaccine, which we will, largely be getting, which healthcare providers, I've already received it. Other people have received it. Literally millions of people have already gotten this vaccine, something like 40% of the population of Israel, huge numbers of people all in the developed world. And so far, severe allergic reaction anaphylaxis, 1 in 100,000. There's been no increased signature of any concerning rise in major complications, death rates, that kind of thing. And people will say, well, it hasn't been around that long, and that's true, but it has to be weighed against the risk of COVID-19. And having seen this disease up close and personal, I can tell you, I've watched it kill, unfortunately, several people, and this is a dangerous, dangerous disease in terms of putting people on ventilators, putting people in hospital. But then the other thing is that the COVID long haul symptoms, the fatigue, the shortness of breath, the heart damage, there are all sorts of people now who are getting COVID long haul symptoms. And I was around for SARS, and SARS was another coronavirus. And I know people in the medical community. The doctor who trained me in family medicine ended up getting SARS, and just devastating long-term medical effects from that. Very healthy guy, and we had 25-year-olds who are off on disability pensions after getting SARS. Right. So I've seen what coronaviruses can do up close and personal, and that's the issue. Is a theoretical concern about a vaccine that's already been given to millions of people and appears to be safe versus a disease that we know is a killer. I think the balance is pretty clear.
And I think that's a helpful distinction for us to hear from someone who's on the front line and seeing the effects of the virus itself, and then knowing, some of the side effects that may happen from the vaccination. I'm not sure. I want to honor the questions as they're coming in. So Rick has asked, how is the vaccine made? And I'm not sure how you can answer that kind of succinctly for us, but if you want to take a crack at that, either one of you, feel free.
Well, Brian, you were describing it before. Why don't you go ahead?
Well, it's particularly the two that we have, so the Moderna and the Pfizer one. It's a new technology. They traditionally, they would be using active cells to grow, to produce, and even experiment whether it's effective or not. These two did not use, I know there was one of the questions might come later on about using the aborted placenta or the fetus. Those particular two, those two that we have in Canada right now, did not use them in the process of manufacturing and did not use them in the process of reproduction. So the only time they were used, and I forget which one they used, but to make sure that it was effective. So of the three stages, so basically there's nothing in the actual vaccine that comes directly from an active like a fetus that was aborted, and most of those are from the 70s and 80s that are used in ethical manufacturing.
Yeah, there is some conversation around the ethics of vaccination generally, and then specifically with these as well. So again, I think that's helpful to hear.
Just a comment, Paul, in terms of about just to kind of reiterate what Brian was saying in terms of these new mRNA vaccines. The advantage of these vaccines is, completely honestly, it wasn't that long ago that just a couple of years ago, we were growing all these things in chicken eggs, just like they were in the 1950s. And that's why the turnaround time to produce a vaccine was a year, which was a big problem with the flu shot, because they would literally sit there at the beginning of the year before flu season and sort of say, what do we think flu season 9 months from now is going to look like? Right. And they would make their best guess. They would grow it all in these chicken eggs. And if the flu mutated, too late, you already you made your vaccine 9 months ago. It was like trying to turn around an aircraft carrier, trying to redesign the flu shot if the flu mutated, which viruses mutate, which you're hearing about now with COVID, with all the variants. the advantage of these mRNA vaccines is the turnaround time is literally a few weeks for them to get it adjusted. So, for example, when you hear the UK variant and the South African variant and the Brazilian variant, what literally they can do is both Moderna and Pfizer can go back to the factory and just say, oh, just tweak the vaccine a bit so it covers the new variant, and that's it. And then 3 weeks later, off the production line is coming a vaccine that covers that, which is going to be a massive advantage given all these variants moving around, because under the old system of vaccine, it would be like, oh, well, it's going to take us 9 months to change that. We got to go grow it in chicken eggs, et cetera. So that's the advantage of these new vaccines, is that they are much quicker to develop, much quicker to produce. I mean, 9 months to get a new vaccine against a new virus, like the previous, usually the last vaccine we developed to something new like this, or to a major illness, took 5 years. So that's the real advantage, is that if a variant emerges that's resistant to the vaccine, they can go back to the factory and literally just change it around a bit. And that's why it was developed the way it has been.
Okay. Mark, you said earlier that we should be getting the vaccine maybe sooner than expected, and we're going to be likely using the Legion as kind of the place where that's going to happen. There's a number of questions that have come in from a number of different people kind of asking the question, okay, so how do I find out when it's my turn to get the vaccine? How are those instructions going to be rolled out?
And that's a really good question. As soon as we find out, we'll let you know. Because we have to, the provincial government has to tell the health unit, who has to tell us exactly how they're going to do it. Because what happens is, for obvious reasons, because all these vaccines involve 2 shots, the Pfizer and Moderna, the government wants to keep track of exactly who's gotten what shot, and they want it, the WHO recommends that you get the second shot within 42 days. So they don't want people getting lost and getting beyond the 42 days if possible. So there's going to be a whole structure to this. So as I say, our Dr. O'Halloran's got the drive-through all ready to go. Our nurses are ready to go as soon as we've got vaccine. But the real issue is the logistics of exactly how they tell us, how many we can give, how we're supposed to record the data, and all that kind of stuff. So basically, we're just literally waiting every day. We go in and check our emails, waiting for more details on that.
So the communication is going to come from the Ontario government to people, or will it come from the local health unit?
It'll come from a bunch of different directions. It'll come from the health unit locally. Basically, as soon as they inform the family doctor's offices, then we'll know. So the health unit is, and there'll be advertising, the government will be advertising, there'll be commercials, there'll be all that stuff. Our offices and the pharmacists like Brian will be informed, and they can inform their patients exactly what the latest data is, and basically it'll be a system where they'll go online, probably book through our family health team. That's what we're expecting, and then book online for a time, and then you do your drive-through, et cetera. And that's how it's probably going to look. But there'll be lots of advertising, lots of notice, and as I say, the most likely thing for the general public is it'll go by age, starting with above 80 first. That's what we've been told.
Okay. I don't know if there's anything Brian, that you want to add to that, or?
Well, I think you've got it on the website now, the Simcoe Muskoka.
Yeah, the health unit. We've got the link. We've got the link down there. So if somebody's not sure, we get that every day. Yeah, if somebody's not sure, like, as things start rolling out, I'm not sure, I didn't get anything, where would you recommend they go to get that information?
The health unit, just as you said, Paul.
Well,
yeah, okay.
Yeah.
So,
and you can check with your pharmacy or doctor's office, whatever. I mean, we're probably more accessible right now because the doctor's offices aren't actually seeing patients to the same degree. But
so when you want to know, when you can get it, just call Brian.
Yeah.
Okay, so there's a number of.
You'll need another phone line, Brian.
Yeah. We'll leave your phone number in the description down below, Brian, just to make sure everybody knows what that is. So,
Well, the exciting news today, as Dr. Wigg already mentioned, that they're looking at going to stage 2, which means they're feeling pretty comfortable about getting out of the first group of people. So they've added 80 and over, and they've added a few other health group like first responders to the next stage. So that's telling us that, and they expect, I think, the end of April to get through that next stage. Is that about right?
Yeah, I think it's going to depend on the supply, and it also depends on. There's a lot of factors. For example, the AstraZeneca vaccine is potentially available if it gets approved by Health Canada. There's all sorts of. It's a lot of moving parts in this. So yeah, as Brian said before, and yourself, Paul, just go to the health unit, and they'll have all the latest data. And you're always welcome to call your local pharmacist, call us, and we'll pass on information. But you'll see lots of government advertising once things are up and running.
And if you haven't accessed any of those, just to reiterate, we have put those links in the video description down below, and you can click on those, bookmark it, and then go back and check it out anytime you want. Or if in doubt, call your pharmacist, check with your doctor. They'll be glad to help you. So there are some very specific questions coming in. So I thought let's just jump for a bit from the generalities and just get into a few more specifics here. So I'm just scrolling through because there's lots of questions coming in. One person has asked that it's said that the Pfizer, Moderna vaccines have only been shown to reduce symptom severity and that they don't stop transmission of the virus. So is this the case that the vaccines won't or may not stop transmission of the virus?
That's a really good question, Paul. The real answer on that is nobody knows at this point. The clinical trial was done, and the main thrust of the vaccines is we want to keep people out of hospital, out of intensive care units, and not having COVID long haul symptoms. No one's done the study on how it obviously protects you, so you're not going to get sick. The vaccine's on the order of 95% effective, but can you get a low grade case and then pass it on to friends, loved ones, colleagues? Obviously in the healthcare, for Brian and myself, the concern is, could we pass it on to patients? They haven't done the study on that yet. We're almost certain it reduces the amount that a person can spread, but we don't know by how much. And that's going to be found out as the months go on. And the take-home message of that is that's why both Brian and myself as healthcare providers are going to be in masks, and a lot of us are going to be in masks for quite a while yet until we have that data.
Yeah. So a follow-up question to that was, if we don't know that it will limit transmission, why should healthy age groups get the vaccine?
Okay, well, I'll start off with that one. The first thing is, even healthy people, it's rare, but healthy people get really sick with COVID and end up on ventilators and occasionally die. There was the young man, as I recall, who was in Hamilton, the stage show, who was in Hollywood. He was a super fit guy, maybe late 30s. And he ended up dying of COVID. There was a young obstetrics resident, 25 years old, ended up dying of COVID. So first of all, even young people rarely can get very sick and potentially die of COVID. The second issue is, even if they don't get that sick, in terms of enough to end up on a ventilator or whatever, young people can still get the COVID long hauler symptoms. The heart damage, the shortness of breath. In fact, there were a bunch of football players down in someplace in the southern US. The whole team got COVID, and they took them into the university cardiology lab, and they found on echocardiogram, they found heart damage on pretty much almost all of them. And so that's the issue, is that even young people can get significant damage from this disease. The second issue is that why young people should care is obviously for their own health. But the second thing is they can be asymptomatic spreaders, and that a lot of young people are, in fact, what we call asymptomatic spreaders. And they're going to take it home to their mom, who's a nurse in a nursing home, who will then take it in and potentially inadvertently, infect the clients she works with. So there's reasons, obviously, for their own personal health care, but also There's a lot of studies that show that young, healthy people are actually the vectors that carry the virus around through the community that then infects vulnerable groups. Brian, I don't know what your thoughts are on that.
Yeah, no, and the simple fact is it's not going anywhere. And unlike SARS, that just sort of dissipated quickly, this one's here to stay. So you keep giving it another victim to carry on. It's just going to move from that victim to the next victim, and it's just going to carry on. It's not going away.
These are, I just want to say thank you for the questions that you're putting in, because your question that you've asked that we get time to answer might be a question that a lot of people who are watching have been wanting to ask. So thank you for participating in this way. There's a couple questions that have come in about pregnant women or nursing mothers. Is it safe for them to get the vaccine?
I can comment on that. The Society of Obstetrics and Gynecologists of Canada has made it clear that they feel the benefit of the vaccine outweighs the risk. Pregnant women, particularly in the third trimester, are very vulnerable to COVID. There are women in the third trimester who've ended up on ventilators from COVID, because what happens is in the third trimester of pregnancy, a woman's immune system gets turned down, so her immune system doesn't attack the baby. But unfortunately, we've known for a long time, excuse me, that influenza can slip under there, which is why there's a big push to get influenza shots in pregnancy. Unfortunately, COVID can do the same thing. So basically, to get a shot, a woman basically has to just talk it over with her doctor, and then usually get a letter from her doctor to take to public health to get approved for the shot.
Okay, so they should talk with their doctor first.
Right, because the vaccines, what happens is the vaccines, because they were put in the trials, generally in any trial for any new medication, any vaccine, whatever, there's certain groups that aren't included, and pregnant women and breastfeeding mothers are one of those. So you'll see things saying that, oh, the vaccine wasn't tried on pregnant women. Well, it wasn't tried on pregnant women because no pregnant women are ever in any vaccine or drug trial or whatever. But at the end of the day, the risk benefit, again, given the danger of COVID in pregnancy, the Obstetric Gynecologist Society feels that the benefit is heavily to take the vaccine. And I can tell you several of our pregnant nurses and physicians opted to get the vaccine.
Okay. So Brian, a question that's come in, someone might come into the pharmacy and say, like, well, I often have I don't do well with meds, or I have some fairly major side effects anytime I've gotten some other vaccinations. So what should I do with this one?
Well, I think it's going to be a requirement no matter where you get the injection. So the biggest thing we're watching for is an adverse allergic reaction, which can happen real quickly. So I think, is it going to be a 15-minute wait period to? Because generally, if we're going
for everybody, if you have a history of allergic reaction, it'll be 30.
Right.
Okay.
So the longer you want to stay around where you're getting the injection, you just let the person know that you're going to be there for a length of time, and until you're comfortable to leave, no one's going to be rushing you.
Okay, so that's actually helpful
site.
for people to know that it's not just it's not like getting tested where you drive up and you become part of the up the nose club. But this is, and then you race off. This is, you get injected and then you wait 15 minutes minimum.
Yes.
Yeah, the Legion's been really good to give us a location. They've got lots of parking in the back parking lot. So they've got lots of locations to be able to take your car. And I took my family there for the flu shots, and we did the same thing, even though we've all had the flu shot before, but we just followed their lead. We went into a parking spot. 15 minutes later, they came and told us it was time to drive away. So
yeah.
Oh, they asked us if we were feeling okay, of course. But
also, Paul, as an aside, I just want to give a shout out to our local Legion, who have been incredibly helpful in terms of allowing us to do the flu shot clinic. They're going to allow us to do. They're allowing us to do the COVID assessment center. The hospital set up an alternate health facility. The leadership and the staff of the Legion have been incredible in terms of supporting healthcare through COVID, and I think they deserve to be recognized.
Absolutely. It's been brilliant to watch. It's been brilliant to see how lots of community groups have come together through all of this. And it's actually one of the good things that have come out of this is to see how people in our community are willing to work together. So another kind of group of questions is one person, Elaine, is asking if you could confirm, will all essential workers, including teachers, be included in phase 2? And then a question similar to that is, will primary caregivers be included with the vaccine if they're giving primary care to the 80 plus? So I think someone is asking like, hey, I'm taking care of my aged parents. Will I get the vaccine with them if I'm actually the primary caregiver?
Brian, I think you've got the list there, and I'd appreciate if you'd look that up. But my understanding is in some jurisdictions that is being allowed. My understanding from the province, and again, this is kind of changing. We hear things from time to time every few days, but it is primarily going to be age-based. Okay. In terms of the emphasis is going to be on going down by 5-year increments. Brian, have you got the latest list right in front of you there?
Yeah, I mean, it does 80 and over, but it does talk about staff, residents, and caregivers in settings for seniors where it's assisted living, not just the long-term care facilities. They are talking about healthcare in high priority levels, and they give you a Ministry of Health guidance, and I looked that up for the healthcare workers, and it did say including first responders and teachers. They actually put that in under the headline of the health guidance. I don't know if that's a complete correlation to stage 2 or not, but they specifically did talk about those groups. So
people may not be aware of what phase 1, phase 2 are. So could you just give a quick synopsis of that? Go ahead, Brian.
So phase 1, we're already into. So basically the long-term care facilities, all the workers at the long-term care facilities, all hospital staff, whether it's pharmacy, nursing, anyone that's working directly. I think that pretty much covers phase 1.
Yeah, patient-facing and long-term care is phase 1. Patient-facing hospital staff, yeah, and long-term care.
So, for instance, we weren't in phase 1, retail pharmacy, but pharmacy in the hospital were included in phase 1. I'm still not 100% sure in phase 2, so it doesn't specifically say pharmacy in that either. So,
all right,
so it's really kind of changing.
A quick point: if you've hopped on a little bit later and you've asked a question that doesn't get answered, if you haven't been here from the beginning, it might be that your question got answered earlier in the evening. There are some questions that are coming in that I think we've already kind of already answered. So I would just encourage you to go back and have a look. This link will stay live on our YouTube channel, or the link will stay up and you can access it whenever you want. Where did that question go? There's a great question in here that is really just for you guys. You'll understand why I'm saying that. This is from Len, how does the PPV of the rapid antigen test compare to the PCR, and do they detect variants? First, you'll have to interpret that, but I think you know what it is.
The antigen tests generally aren't as accurate. The PCR test, which is the test up the nose that you just referred to, Paul, is the gold standard test, and the antigen tests aren't as accurate. So obviously in the hospital, in healthcare, where we have to know whether the person has it or not, or let's say we're testing someone from a long-term care home or whatever, we need to know with the highest degree of accuracy, as much as we can. Anyway, no test is 100%, and the test isn't, but with the highest degree of accuracy. So that's the test we tend to use. Where the antigen tests and what they call so-called rapid tests come in is more in workplaces. They'll be the kind of tests that are easier to administer. So for example, let's say you work in, I don't know, a meat packing plant, which is obviously a high risk place. Doing antigen tests on everybody when they come to work every day, they're quick, they're easy, And if someone tests positive, well, you go home and then, go to the COVID assessment center and get a proper test and whatever to try and, cut down on spread. So antigen tests have their uses in industry and various other things, but they're not as accurate as the tests we use. And that's kind of the big difference between them.
Anything you want to add to that, Brian?
No.
So this is.
I know what. Oh, sorry. I was going to say, I know, a few that like the Honda plant in Alliston, they'll test everyone, and it's a very quick response. And it's the same idea that Dr. Quigg mentioned, that if you're negative, you're negative, but if you're positive, go and get the reinforcement with a traditional COVID test. So.
That is great. So that's a great question, and it's for those of you who are in the know. But there's some questions here, quite a number around the mRNA. Is this injection the same as the mRNA that's in our bodies? And then where does it go in the body? How well is that being studied?
Well, my understanding is that I'm not a molecular biologist, but it enters into your cells and basically uses your body's own machinery to produce antibodies to the spike protein on the COVID-19 vaccine. And I mean, the process has been studied. Again, the issue comes up as, in all the clinical trials, and so far in millions of people that it's been given to between the Pfizer and the Moderna, no serious side effect signals have arisen. Obviously, that's a concern, and things are going to have to be monitored going forward. But again, it all comes down to a risk benefit. It's the issue of a vaccine that, as far as we know, seems to be safe. There's no major signals. 30,000 people in the trials, everybody's still doing well, versus a disease we know that has a serious fatality rate, as well as, the COVID long haul symptoms and et cetera. The risk benefit, I think, for most people is pretty clear.
Okay. Another question here from about what sort of information leaflets and consent forms will be used to ensure informed consent is properly obtained when people get the information they need regarding safety and efficacy.
Well, I can speak to that one. Having had the vaccine myself as a frontline healthcare provider, there is a standard provincial form that you have to sign, that you have to download, you have to write up, you have to sign, you have to prepare. And then when you go to the vaccination site, they go through it with you point by point. So, yeah, basically everybody gets full informed consent before they get the vaccine.
Anything else, Brian? I've got one for you next.
I haven't been through the process. So.
We'll get you one soon, Brian.
Yeah. So Brian, I thought I'd ask you this one. One person is asking, my pharmacy is in Alliston, my family practice unit is in Toronto, my husband is in Orangeville, and we live in Mulmer. Where would we go for our vaccines?
That's a great question. I believe the clinic will only be doing the fit group. Is that correct, Dr. Quigg?
I think, well, no, it'll be the same as the flu shot. People in our catchment area will do. Generally, I suspect what'll probably happen with the clinics is, like, for example, the COVID assessment centers, we took all comers. So I suspect what'll happen is most clinics will, that's probably the way it'll go down, although I can't speak authoritatively to that. What I would just say is, whatever your closest clinic to where you live is, will probably be your best option. If you live in Mulmer, just figure out whether it's Orangeville or whatever the closest clinic is, and that'll probably be your best option.
All right.
And at that point, it might even be available at the pharmacies, which means you just go to our closest local pharmacy. So.
Right. Yeah, that's a tricky one. So I think we already addressed the idea of, the concern, is this a vaccine? Is it not a vaccine? So there's a person kind of asking that, but then they have part of their question, which I think is a helpful question, is, will I still be required to wear a mask and social distance after the jab? So can you two talk a little bit about, if we all can get the vaccine kind of, by early autumn, then what's going to happen as far as wearing masks and distancing are concerned?
It's probably going to continue.
Well, they talk.
Oh, go ahead, Brian, you first.
No, I was going to say, they call it herd immunization. So is it 2/3? Is it 70%? But basically, you need a high percentage of the locals vaccinated before you can start taking off the measures of, taking off the mask and potentially passing it from person to person. And as Dr. Quigg already alluded to, we're not even sure initially how long it'll take before you don't become, a carrier, even though your body's fighting it, and how easily you're going to give it to someone else. So
Right.
I think you're looking into late fall, early winter next year before I think masks might start to be lifted a little bit. But
We're not going to hold you to these because we know, like, it's kind of feeling along as we go. But yeah, what do you think, Dr. Mark?
Well, basically, in terms of we at the beginning a year ago when this all started, everything changed every 24 hours, and then it was every 3 days, and now it's probably every couple of weeks. But I think Brian's point was well taken, that until we reach herd immunity, and until we have the studies back showing how much the vaccines actually protect us from spreading the virus. The good news is they keep us out of ICUs, they keep us out of hospital. We don't get either sick at all or very sick, which is great. But how much does it keep us from passing it along? And the honest answer to that question is we just don't know. If the numbers come up really high, that it prevents 80-90% of transmission, we'll get a herd immunity, as Brian was referring to, a lot faster, and that'll be great. If it's 20, 30, 40, 50%, then that's still going to be a bit of an issue. And then, of course, the variants and what they're going to do is, I think the key message about the variants are, we are our brother's keeper in this, in that not just because that's the right thing to do, but also because of self-interest, in the sense that obviously our first priority has to be to look after our own community and et cetera. But this virus needs to be stamped out in the developing world, because if we don't, it's just going to keep bouncing around and mutating and come back with new variants that are resistant to vaccines, et cetera. So this needs to be a worldwide effort to turn around and vaccinate everybody.
That's maybe a helpful point there, that the sooner we can control this, the less chance there is of new variants and always trying to keep up with those variants. So I think that's actually a helpful thing, Mark.
To put that in perspective, Paul, every time the virus infects a new person, there's always a chance it's going to develop a new variant. And to be quite honest, there's a California variant. There's 3 or 4 different variants moving around the U.S. There's obviously the UK variant, which we have here. And so the only way to really stop that evolutionary pathway, which is always going to evolve new versions of the virus that might start to outwit the vaccines, is we have to shut the transmission down everywhere. And obviously that involves the developing world as well.
Yeah. So there was talk earlier on about the vaccine starting with 80 plus and going down in 5-year increments. One person is asking, what about children? How young is this going to go down to for vaccination? So, and should we be concerned about the long-term effects a vaccine might have on children?
The clinical trials on children have just started. Because again, we were talking about vaccines, basically because children can still get sick with COVID and get very sick actually, but it's rare. So as a result, the clinical trials were done in adults. So we don't have any vaccine data. So none of the vaccines are approved for children. The AstraZeneca vaccine just started trials for children. So we'll see over the next 6 to 9 months about what that shows.
Yeah, because I had someone ask today, like, well, if children are going back to school and they're going to be all together, why don't we vaccinate them first? And I think that answers that question because there've been no trials done on that yet. So that's good. Here's a lovely question from someone. Are you going to have enough staff to administer the vaccine when it's available? And how might some eager volunteers be able to help with the rollout in our region?
We may be calling you. We'll see. Let's put it this way. Every doctor and nurse I know worth their salt is just itching to get their hands on the vaccine to start putting it in people's arms. And we may end up needing volunteers. Brian was already saying and he can comment on the pharmacy techs being trained to use it. But I know in Britain, they have teachers giving vaccines, short course, show them how to do it. It's not complicated. And they're getting everybody involved. So we may go down that road. It depends on how much vaccine we get and how quick it comes, et cetera. But Brian, maybe you could comment on, I know your staff are getting trained to do some vaccinations too.
Yeah, because I think even at the pharmacy level, as quiet as things might be right now, if you have lots of people coming in for injections on top. So it was just about a month ago, they brought in with the pharmacy technician course that they can now, go. And so I know one of our girls is a pharmacy technician, so she's already signed up and she'll do her course, I think next week on site. So I think for them to bring that on quickly, they obviously anticipate that eventually we'll be in the mix for doing the injections.
Just to put things in,
so then there'll be lots of.
Yeah, just to put things in perspective of the logistics of this. The population in North America is, well, I'd say the USA and Canada anyway, is roughly on the order of like 400 million. When you consider 400 million people, 2 doses each, that's almost 1 billion doses. And then that's a billion needles. Like the logistics of this are really, this is man on the moon stuff in terms of the fact we've had a vaccine in 9 months. We're going to vaccinate how many billion people around the world. Like this is an incredible logistical undertaking. And for all the problems and difficulties, and there have been many, the fact that we've done this, this is, I'm old, so I remember the moon landing. This is moon landing level of, people working together. And it really shows what we can as a species if, working together, to make the world a better place, what we can do.
So I don't want to put you guys on the spot, but if volunteers are needed, would you know like where people could find out about the need for volunteers? I mean, certainly we will be willing to post stuff. We have lots of people that track with us, so we would certainly make that need available and you can let us know. But would there be other places that you'd recommend people go and look?
I'd say it's a bit early right now.
Yeah,
and the conventional system has to kind of get filled up with vaccine and start administering and then see how we do. But, basically, as they say over in the UK, watch this space because that's how Britain did it. And, the health unit, again, would be the place that you'll start to see probably the lead info on that from. But, we may be needing you.
Yeah. Another question here, how many of us percentage-wise need to be vaccinated before we can safely return to some type of normal?
Actually, I think what Brian said before was absolutely right. 70, 80%, somewhere in that ballpark. And what past you would say would be vaccination versus combined with people who've already had COVID infections. But what's happening with some of the variants are people who've had the COVID infection before are getting reinfected with the variants, and the vaccines seem to be a better guarantee against that. So what Brian alluded to before, 70, 80% is about right.
All right. Just another really kind of practical personal question for either of you is one person has said, I'm on chemo and I can't get the vaccine. So how long before I finish my treatment before I can get it?
I would talk to their oncologist because Officially, because again, we were talking about the clinical trials and who was put in there. Children aren't put in the clinical trials. Pregnant women aren't. Chemo patients aren't in the clinical trials for obvious reasons, because they're going to have a lower immune response. And, that obviously the company that's developing the vaccine doesn't want that going against their numbers. But for those kind of folks, just like pregnant women, it's a risk benefit thing. So they should talk to their oncologist about saying, about getting the vaccine. And my honest feeling is I think the oncologist will tell them, at this point in your chemo cycle, this is the place you should probably get it, and then just give them a letter, and then should be okay.
Yeah. Is there anything I can do when my turn comes to make my vaccine as effective as possible?
Well, one thing I will say, and it's theoretical. Years ago, we used to tell young moms before they got their children vaccinated, oh, we'll give them Tylenol an hour before so we won't feel the pain as much. But in fact, by reducing a little bit of fever or post-vaccine pain, in fact, it showed that it reduced the effectiveness, a few percentage points in terms of the vaccine. So I wouldn't necessarily be taking any Tylenol or Advil or anything like that before the vaccination that you wouldn't normally take, at least anyway. I wouldn't go out of my way to take it. That's probably the one thing. And other than that, for example, it's common after the Pfizer vaccine, a lot of people get a sore arm. And if it's really sore and you have to take Tylenol, that's okay. But the thing is that better not to take Tylenol or do whatever if you can avoid it.
And I just think being as healthy as possible going into it is crucial. So if you've got a slight fever, if you're dealing with, allergy season is going to be coming up, just the best you can feel, I think will be a benefit.
Good point.
So for either of you, what repercussions might you foresee for those who elect not to be vaccinated?
Well, that's obviously, it's a personal choice. The issue is going to be, there's going to be two issues. The first issue obviously is getting COVID. If you obviously get sick, end up in a hospital, end up with COVID long haul symptoms, sitting there thinking that, gee, all I did was get a vaccine and I wouldn't be here, that's going to be a fairly tough place to be. So that's one issue. The second issue is there are going to be activities and things that, people talk about vaccine passports. I don't think it's going to come to that, but I think there are certain activities, take, for example, cruise ships. I think there's a high likelihood that cruise ships won't accept you without proof of vaccination. So there will be limits on some of the things you may choose to do in your life if you don't have proof of vaccination.
Anything else for that, Brian?
I mean, it's hypothetical, but I might say any traveling might require, would the US allow you to cross the border without it? I don't know that for certain, but I can see it being a realistic restriction. So,
yeah. This is another, I think, helpful question. Should I get the vaccine if I've already had COVID and been resolved? I think they're thinking because I have antibodies then.
The answer is yes. As long as it's been 90 days since your COVID infection, and the exact reason is we're starting to see reinfections with the variants of people who already had COVID. For example, in Brazil, the upper Amazon near Manaus and Iquitos up there in Amazonia were devastated by the first wave, and people thought, well, we've got immunity. The Brazilian variant has gone in and has caused devastation with a second wave. So basically the variants, if you've been infected with the original COVID virus, the variants seem to be able to reinfect at least a percentage of people. And the vaccines seem to do better. So basically, the recommendation from both Health Canada and the CDC, the Center for Disease Control in the States, is as long as your COVID infection was longer than 3 months ago, 90 days, you should get the vaccine when available.
All right. So we have gone an hour. There are a couple other questions. One other quick one was, we talked about the vaccines happening at the Legion, but someone's asking, like, will there be a center in Wasaga for?
Yes.
Okay, so somewhere in Wasaga there'll also be a place where people can go, and when that's set up, they'll find out about it.
Yeah, the plan is at this point, and again, if people could cut us a little bit of slack here, because everything's always changing as we're getting, government information, kind of things are changing rapidly. My understanding is that it will be where the COVID assessment center works out of in Wasaga.
Okay. So I have a final question for you, Mark, and then some closing questions for each of you. But this is actually from us. How's the morale of our frontline workers? Brian, I mean, you can jump in on this too, that you guys are aware of. How are people doing right now?
Well, I'll speak, maybe from the hospital perspective. Our staff and our family health team. I can tell you, our frontline staff, our nurses have been absolutely heroic, is the only way I can describe it. When we have a COVID patient in the hospital, I might walk in that room once a day. Our nurses are going in 10 times a day. And they've been full out 110%. Our COVID assessment nurses from our family health team, in pouring rain, freezing cold, they've been out there for a year and they're tired. But they're professionals and they're going forward, et cetera. What they're really afraid of these days, and I'll be honest about it, is, and we're all afraid of, is a third wave. Basically, the variants are out there. The UK variant is in Simcoe County, and you just have to look at what's happened in Newfoundland in the last 2 weeks. This thing can explode, and it's here. The Roberta Place outbreak that was so tragic has basically seeded Simcoe County. And so essentially, I guess my plea to the people watching is, the government's trying to ease up the restrictions, and obviously there's lots of economic reasons for that, and people are tired, and I get it. But it's absolutely essential that they continue to follow the rules, the public health recommendations, that they, really try to stick to their households and keep following the directives, because if not, this UK variant is going to explode on us. And the scary thing is that the province got to 3,500 cases a day, and the ICUs were almost overwhelmed in the entire province. This thing could go to 6,000. The projections from the modeling table at the provincial government is this thing could go to 6,000 cases a day like that if we're not careful. So, the staff, our frontline staff, our nurses, our respiratory therapists, et cetera, they've been absolutely heroic. They're tired. It's been a year, but they're going to finish the mission, but they need your help. Everybody has to keep following the rules. We're all tired, but they need to do that, or this variant could explode on us, and then we're into a third wave that could be worse than the previous two. So that's what I would really like to do on behalf of our heroic nurses, is just ask people in the community, just keep holding the public health rules just a little bit longer until we can get more vaccine in, and then things will get a lot better.
Yeah, both of you see things that the rest of us don't get to see. So just, again, for either of you, like Brian, maybe your biggest concern over the next few weeks or months, any final words you'd like to offer?
Well, I think Dr. Quigg mentioned tired is definitely, but I think morale is at an all-time low. It's been a full year. I talk to almost everyone that comes in the store. I have more time to talk. I guess that's a positive. But there's not a lot of happy faces, not a lot of smiling faces. And to be honest, my seniors are more worried today than they were worried 6 months ago. So, they're going to hold the course. I don't think they're going to be an issue, but I think it's the youth and the younger adults that are frustrated, don't have a place to go, maybe, place to just be kids or being young adults. But I think we've got another 3 to 6 months of really trying to bunker down to keep it from flaring up again.
Mark, any final words?
Well, just to thank the community. And first of all, fellow healthcare professionals again, I'd like to thank, well, Brian, for example. He's my personal pharmacist, and he's open every day, helping our patients, et cetera. And so I'd like to thank him since he's here tonight. But again, all our heroic frontline staff, our cleaners, our nurses, our respiratory therapists. You know, it's just been amazing in terms of you know, the dedication, the heroism they've shown. But I'd also like to thank the community. I think I remember being here a year ago, sitting in the boardroom here at New Life, and we were talking about how if we're going to go through a pandemic, this is a community I wanted to be in. And whether it's the Legion stepping up, I'll never forget when in the first wave where we didn't have enough PPE, personal protective equipment, people in the community were like using their business contacts to get PPE off of planes coming from China. People were making PPE. We ran out of gowns, sterile gowns to protect the nurses, and a group of local seamstresses got together and produced hundreds of gowns that basically kept us going for about 2 months at when no one else had anything, and we had gowns to protect our nursing staff going into COVID rooms because you know, a group of local seamstresses just got together and made them by hand. And the shield I use at work is still one of the donated shields that was given by members of the community. Just went together and used their 3D printer and put it together. So this is an amazing community of amazing people who have pulled together and supported us and the first responders and our incredibly brave firemen, paramedics, et cetera. So again, on behalf of all the healthcare providers at the hospital, and I think the family physicians, and I think Brian would agree with me, we just want to thank the community for their incredible support, and we just need your help just a bit longer.
Well, on behalf of all of us, I want to thank both of you. I think it would be nice to know both of these gentlemen took some time out of their family day on Monday so that we could do kind of a dry run of this. We haven't run something like this before, so we wanted to make sure that we got the tech right and got the format right. And thank you both for doing that, for being here tonight, sharing with us, for being part of our community. And on behalf of everyone, I want to say thank you. And you've both alluded to people that are doing things, and I want to finish with just something that Mr. Rogers said. And some of you will be familiar with this. He said, when I was a boy and I would see scary things on the news, my mother would always say to me, look for the helpers. You can always find people who are helping. And I think that's an encouragement for all of us, because some of this, you know, it's COVID fatigue. We're tired of hearing about it. It's depressing. We're in the middle of winter. We're in the middle of this COVID ice age, and we're weary. And my encouragement is look for the helpers. And I think Fred Rogers had something really insightful there, and it just reminds me of something that Jesus said to his followers. He said, love people like I've loved you. And when you do that, it makes a difference. And, you know, the community has come together in that old proverb that says, if you want to go fast, go alone. If you want to go far, go together. And so I encourage you to just continue tracking together along with people like Mark and Brian, working together in our community and holding one another up. And thank you for the time that you've given tonight. Again, if there's stuff that you need to know, there's some links down below that you can click on and find out some more information. Do talk to your doctor, do talk to the pharmacist. And it's been great having all of you here tonight. God bless. Bye for now.